I just started the recording.
Yay!
Hi, everyone, and welcome to our Let's Talk today. I'm Dr. Josh Eyers, and I am here with Angela Hammond, and we're going to be talking about safety for essential employees. And it is basically going to be a prevention talk, talking about how to minimize our risk on campus from COVID-19 and off campus, as most of us are. So I'm Dr. Josh Eyers. I'm an assistant professor in the Capstone College of Nursing. I'm a researcher in integrated behavioral health, opioid treatment, and LGBTQA health. I got my degree, my PhD, from the University of North Carolina at Charlotte in clinical psychology. And I am happy to have with me today Angela Hammond, who is a certified registered nurse practitioner and also a diabetes educator. And she is the quality coordinator for that program at the faculty staff clinic at UMC in family medicine as well. I'm sorry, Angela, I don't know all of it that you're doing over there.
That's okay.
She did a fellowship at Duke in nurse leadership, which is really cool, and graduated from UAB a little while back. Okay, so today we're going to be talking, what's that?
A long while back.
Not that long. We are going to be talking today about how to keep ourselves safe. So we're going to be going over the CDC prevention tips, and we're going to briefly touch on a few other topics, including stay-at-home orders and updates to the CDC guidelines, what to do if you get sick, and then we're going to recap a little bit about hand washing and social distancing. And we'll be taking questions at the end. And so we're going to talk for about half the hour and then take questions after that. So, Angela, I'm not sure how you want me to do this. Do you want me to just run through these tips real quick and then we can take questions later?
Sure, that's fine.
Okay. So the first one of the tips is to know how the coronavirus spreads. There's currently no vaccine, as many of you know, so the best way to prevent illness is to avoid being exposed. The virus is thought to spread mainly from person to person between people who are in close contact with one another, and they say that's within about 6 feet. There is some evidence that maybe it'll spread farther than that, so keeping good buffer zones is important. It's thought to spread through respiratory droplets produced when an infected person coughs, sneezes, or talks. And these droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. And some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms. In fact, we have very good evidence of that. There are lots of people who appear to be asymptomatic but are still contagious. So what you should do, clean your hands really often. You should wash your hands with soap and water for at least 20 seconds. That's row your boat 2 times, especially after you've been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol and cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Of course, the moment I tell you that, your face starts itching, right? And it needs to. You'll notice I touch my face a fair amount during this. The way I talk to people about that is I say hand sanitizer is great if you can't wash your hands, but it only tides you over until you can. So don't think that hand sanitizer is just as good, but it is better than nothing. Did you have anything to add to that, Angela?
Washing your hands is the most important thing to remember in avoiding COVID. So thinking about washing your hands when you get home from work, when you get to work and you've been working and you decide you want to drink or it's time to eat, make sure that you wash your hands before you do that. Wash your hands, of course, all the times that we know that mom always told us, wash your hands after you go to the restroom, wash your hands if you touch anything that's exposed, especially like door handles, cabinet knobs, the grocery store buggies, anything that's used quite often by other people, make sure that you wash your hands after touching those types of things, especially before you eat or drink.
Yeah, and one of the things to think about is if you're in an environment where you might be exposed, try to keep track. Have I washed my hands in the last hour? That'll just sort of help you to keep in mind to wash your hands. So to help y'all with that, I found this cool video that teaches you how to wash your hands with good technique. You don't need to use paint. Y'all can use soap. All right. We're not doing that again. Okay. So did y'all have any questions about hand washing? Was that a comment?
That video reminds me of the tablets that our dentist gave us when we were little kids, before and after you brush your teeth, to show you all the spots that you miss when you're brushing your teeth. So it's super easy to miss some areas, and the friction is very, very important when you're washing your hands, using that friction, rubbing your hands together and between your fingers. So that was an excellent video to show you how easy it is to miss areas.
Yeah, and it's something you can do at home too, with a little bit of food coloring and some soap or something like that if you want to give that a try. Okay, so the next guideline is to avoid close contact, and we've spent a lot of time talking and thinking about this lately. So the first thing is to avoid close contact with people who are sick. If you know someone is sick, it's best to avoid them entirely if you can. Another thing is to stay at home as much as possible, and we've been doing a lot of this lately with our stay-at-home orders in the state. And in Tuscaloosa, Mayor Maddox has been having us out in front of the curb about staying home. And then the third one is to put distance between yourself and other people, and I think this is one of the guidelines that is easiest for us to struggle with, because some people just don't seem to get it. And so that's hard. And it's hard to tell somebody back off without feeling like you're being really rude. So that's an important thing to do. But a lot of us are also going out to get sunlight and get some exercise. And one of the things to keep in mind is that if you're running, then you're moving through the air more quickly. And so running behind somebody just 6 feet may not be enough space, because you're actually mixing that air better. So having more buffer zones when you're running and walking and being outside is a good idea. Any comments?
Excellent. Excellent. And also the buffering and the social distancing is super important just because of what you said earlier. A lot of times people who do have COVID may not have any symptoms, or they may be so mild that they don't think that they are sick. So social distancing is exceptionally important for us. And I know it's difficult, and especially thinking about this weekend, a holiday weekend, when we usually get together with friends and family, lots of kids, lots of children's activities. Something to particularly think about is children in particular don't seem to get as sick with COVID as adults, and may be carriers of COVID and we don't even know it. So something especially important, although, we hate not to get together for these important events, sometimes it's particularly important to avoid the social closeness that we crave and that we love to protect ourselves and our families. So something to think about coming up this weekend. We may want to get together, but it may be best this year to skip that.
Right. And the phone still works. We can still call people and tell them we love them and we miss them and want to see them.
Exactly.
Okay, so one of the next ones, this is a recent update, is that the CDC is now recommending that we wear masks when we go out. And the reason that changed is because they were initially saying that masks weren't very helpful in keeping you from catching it. But they've really come to recognize how important it can be to keep us from spreading it. And in particular with COVID, we can be contagious without knowing it. It can take 4 or 5 days for us to start showing symptoms. And so if all of us, when we go out, will start wearing masks, we can actually decrease the transmission of it even more. So that's what this is getting at. Everyone, they say, should wear a cloth face cover when they go out in public, for example, to the grocery store or to pick up other necessities. The cloth face covering should not be placed on young children under age of 2 or anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask. The cloth face cover is meant to protect other people in the case you're infected. And you do not use a face mask meant for a healthcare worker, because we need all of those for the healthcare workers. And continue to keep about 6 feet between yourself and others. It's not a substitute for social distancing. It won't necessarily keep you from catching it, but it might keep you from transmitting it. Angela, do you have anything to add?
I just want to say the first time that I went to the grocery store with a mask on, I felt a little silly. But I think for practical purposes, it's something that we all need to think about doing. And if you don't have a face mask, I'm sure probably plenty of you have seen social media with the guides how to make a face mask using a bandana with the coffee filters and all these sorts of things that you have at home. So it's pretty easy to do. And if that can protect you from giving COVID or possibly protect you from getting it, it's easy. And the more people will do it, then the less isolated those who started the trend. We're not going to feel silly anymore. It's something that's practical. It's something that'll help everybody stay well, and we need to all do it when we go out in public, and encourage others that in your family, your friends, if they're not already doing it, encourage them to join you as well.
Yeah, and another thing that it doesn't say here is that when you get back home, you should wash the mask. Soap and water is good. Throw it in the washer if you're not going to go out again for a while. But make sure you wash it and not just set it aside or reuse it
Exactly.
immediately. Okay, and then we've all been told to do this from the time we were little kids, but it's really important to do it, especially now. If you cough or sneeze, make sure you cover your mouth. If you're in a private setting and you don't have a face covering, remember to always cover your mouth and nose with a tissue or the inside of your elbow. Throw the used ones in the trash. Don't reuse your tissues right now, at least. And immediately wash your hands with soap and water for at least 20 seconds. I mentioned earlier one of the tricks I use to help myself remember when I'm doing a full wash like that is to sing row, row, row your boat to myself 2 times in a row, because that gets me to 20 seconds. And again, if soap is not available, you can use hand sanitizer until you get to soap. Any comments,
Yeah.
Angela?
And that hand sanitizer, you need to use it and keep rubbing your hands together until it's completely dry. And sometimes that can take up to about 4 minutes. That sounds like a lot, but to completely allow the alcohol to work its magic, try to do that until it's completely dry in between your fingers and all over your hands as well.
Great. Okay, and now we're going to talk about cleaning and disinfecting. And I brought all of this in, but I know you want to talk about it too, Angela, so I'll just give a brief overview here and then hand it off to you. So the CDC recommends that we clean and disinfect frequently touched surfaces daily. That's tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. And if surfaces are dirty, clean them using detergent, soap, and water. And I don't know, Angela, if you can see real well what I have there on the bottom of the screen, but that's more stuff from the CDC. Do you want to just take over? Okay, let me read that. So what it says is to disinfect, the most common EPA registered household disinfectants will work. Use disinfectants that are appropriate for the surface. Options include diluting your household bleach to make a bleach solution mix. That's 5 tablespoons or about 1/3 of a cup of bleach per gallon of water, and then 4 teaspoons of bleach per quart of water. You can also use alcohol, ensuring that solution has at least 70% alcohol. And then there are other common EPA registered household disinfectants you can use.
Yes. And those bleach and alcohol solutions need to stay on a surface for about 1 minute to disinfect the surface. So think about that. You know, you don't want to spray it on and then immediately wipe it off. You need to let it sit for about 1 minute. That's all. You can think about making just a whole gallon of the bleach solution and then maybe pouring it in containers that you can use in a spray bottle that you could use to spray surfaces. You might want to check with the manufacturer's recommendations on things like your computers, your mouses, to see what they recommend. Most of them will probably be more likely to want you to use a little alcohol solution rather than the bleach. But again, check with the manufacturer's directions on cleaning those sites. Thinking about, like you said, all those surfaces that we all use all day long, the door handles, the refrigerator handle, the faucets, those kinds of things need to be wiped down. If you do have a sick person in your household, they can be in a separate bedroom and bathroom, and if they're able to, make sure that they have the ability to clean and disinfect those areas themselves. And if they're not able to, try to help them with that. But you may want to, like if they were using a common restroom, try to let it sit for about an hour before you go in after they've been in there if you can, and then go in and clean and disinfect. You don't go immediately into the same area that the sick person's been in. You need to wait just about an hour if you can.
And I'll add our phones. We have them with us all the time. We talk right next to them. So think about disinfecting your phone while you're disinfecting other things. Think about it when you're washing your hands. Obviously, you don't want to just stick it under the faucet with the soap, even though some of these phones are supposedly, you can do that with them now. Now is not the time you want to go without your phone, so you might not.
Exactly. Let's not try that.
But if you've got alcohol wipes, those work really well for that. And if you're nervous about the protections on the screens and stuff, check with the manufacturer's guidelines about that. But our phones do pick up lots of germs, so it's one to think about. Okay, so I thought I talked about that. Yeah, I did. Okay.
I have a question for Angela.
Yeah.
Angela, do you have any guidance for people who may have an essential worker who's in their household? we're all sheltering in place, but some of our loved ones have to go to work. Any suggestions on how to kind of decrease your impacting COVID?
Sure. My husband and myself were both work in healthcare. So some of the things that we try to think about doing is taking our shoes off in the garage. If we are around someone that we think may have had something like that, we may take our clothes off in the garage too. Don't shake out dirty laundry. You need to go and put it directly into the washing machine. You don't have to wash it then. I mean, you can just keep that washing machine area available for all your dirty clothes until you're ready to wash a load. But doing that, first thing when you get home, washing your hands when you get home. Some people who are in direct contact with folks who are sick, then they may want to jump in the shower as well when they get home. If not, then of course washing hands or any other visible body surfaces that could be contaminated would be an important thing. And the phones, you were talking about the phones. You had your phone at work, and then you definitely will want to decontaminate that as well. Because, what do we do with it? We lay it on the counter, we put it here and there. Our kids pick them up to play with. So I think that's an important thing to do as well. And, thinking about people who work, say, in law enforcement, they may not be able to have on protective clothing sometimes when they may have some interactions. So thinking about using some disinfectants on areas that they touch a lot, like their belts, their guns, also, steering wheels, the opening to your car door on the inside and the outside, and thinking about anything that you touch probably needs to be wiped down.
Okay, good. Thanks.
Yeah, okay, good. And rule of thumb on that is just think like if you walked through a cloud of stuff, what would it touch? What would it get on? Okay, so evidently I had some extra slides dumped in here that I didn't notice. Sorry about that. So we're going to talk about some other topics now. One of the things is the stay-at-home orders. We're not going to go into too much detail about that, but that's related to social distancing. And Angela, did you want to talk about social distancing?
Well, then we kind of touched on that through some of these other topics, but the 6 feet away. And sometimes that's difficult to do, especially in some of the grocery stores that have very narrow aisles. So, trying to think about, well, when's the best time to go when it's not going to be crowded? And I found out last weekend that when I thought that was going to happen, did not happen. So I wound up turning my car around and going to the third place that I came to that did not have a crowd at the door. So, sometimes you have to shop at areas maybe that you're not accustomed to just so that you can be away from a crowd. But, trying to go down a different aisle than one aisle that may have several different people. And again, that's difficult sometimes when you're shopping and you don't have another choice. Other things you can think about is having someone do your shopping. There's lots of shopping services around. Seen where some students from UA have started some shopping services for some of our elderly folks in the community. So that might be an option. Another option, is ordering food out and thinking about those kinds of things. And several people have asked me about, well, what about what you buy from the grocery store? Do I need to wipe it all down? There's not been any history that we know of anybody catching COVID from their groceries. But if you do want to wipe it down after you get home, there's nothing wrong with you doing that. If you do that, you would wipe it down and then place it in your cabinet or in your refrigerator. And then the next thing you would do would be, make sure that your hands are washed.
Yeah, and think about chain of contamination too. So if you work and then you're wearing the same shoes into your car and then you put your groceries in the floor of the car, you might be exposing those bags of groceries that way.
Sure.
We have
What
one.
about, Angela, what about why we're staying at home right now?
While we're staying at home, large crowds have been shown to cause the COVID to spread through the communities. There was a case in New Orleans and also in Chicago, family get-togethers. One was a lovely 86-year-old matriarch of a family who had a birthday, and she didn't really have a party, but she had a walk-through celebration through the house. And unfortunately, she developed symptoms and had COVID, and 3 other members of her family, as well as herself, actually passed away from the COVID. Several other members of the family also developed symptoms and were sick, but fortunately did recover from it. So thinking about things like that, staying at home, even though we want to celebrate and do things together, or we want to join our friends at restaurants, at concerts, or just on the corner at the sidewalk, or for a football game. A tag football game is a place where you might be around somebody who's asymptomatic and they don't feel sick or look sick, but you fist bump them and give them a hug because you're so glad to see them, and you may have passed the COVID to one another. So stay at home until this kind of passes, and hopefully we'll have a vaccine developed later in the year that'll help protect us. But staying at home orders are one of the most important things to keep this, what they say, keep it flat, or keep the spread from other
Flatten the
people.
curve.
Flatten the curve, and you can see where it's really been beneficial in other countries, particularly South Korea and Germany. Their infection rate's been very low, and I think if we can continue with this and not be impatient, that we can really flatten our curve and prevent a lot of infections and a lot of deaths.
I thought it was really funny that Dr. Fauci said that we should all stop shaking hands. And he said, we should just stop shaking hands. Like, we should just never do that again. And I thought, well, yeah, an infectious disease doctor would probably say that, but I'm from the hugging South. We're going to greet each other. We just can't do it right now.
Exactly. Yep.
Okay.
We have a question from somebody.
Okay. Mm-hmm.
This particular person's in law enforcement, and they spray the places that they touch in the car with Lysol. They want to know how long they should leave that Lysol on before wiping it off. And then, is it safe to be in the car after using the Lysol? I guess they're talking about the patrol car.
I would make sure that Lysol was on that surface for at least a minute, just like the other disinfectants. And I would probably also, have the windows open. I don't think I would spray the Lysol while I was sitting in the car. Well, I guess you have to be sitting in the car, but I would open the windows because I don't think you want to breathe in that Lysol for long periods of time. So open the windows and let some air in. Step out of the car after you spray the surfaces would probably be the best thing to do.
Okay, great.
Great. So the CDC recently updated their guidelines, like yesterday or the day before, like that recently. And what they're doing is sort of changing up a little bit what they've been saying about how to use personal protective equipment and what kind of workers should be in line to go back to work. And we're not going to talk about that in too much detail because I know the university is still evaluating that and thinking about what their policies are. But I did want to make y'all aware of that. And it's focused, the change in guidelines is focused a lot on essential employees, looking at people in healthcare and in the food supply chain to see about, when they can get back to work. Yes. Angela, do you have anything to say about that?
So are we talking about when can they go back to work after exposure or after they've been sick? Or
Yeah, so I'm not getting into the details of the guidelines, but yes, they're talking about both of those things. When can people get back to work? How quickly can they get back to work after having been exposed and things like that? So mostly I just wanted everybody to know that there might be some changes coming based on
Okay.
the guidelines.
Yeah. So the best thing if you've been sick with COVID is to make sure to check with your healthcare provider and get their direction of when it would be a safe time for you to return to work. CDC guidelines, I think the last time I read those were you need to be without any symptoms for no fever for at least 72 hours, no symptoms for about 7 days, and improving, continuing to improve.
Mhm.
I know those have changed pretty rapidly. All guidelines everywhere, I think, are changing day by day. Um, but I think that probably the best way to figure out when you need to go back to work if you've been sick is to check with your healthcare provider.
Right, which gets us to the next couple of things. What to do if you get sick. The number one rule is always to stay home if you're sick. That's still
Yes.
true. If you're sick, you should still stay home. If you're starting to feel symptoms and you're not sure, you're going to want to talk to your doctor and perhaps get evaluated. And UMC has some new procedures right now, which I put down there because those also apply to the faculty staff clinic, I believe. Is that right, Angela?
Yes. The UMC personnel are triaging all patients who come in to the center. We're seeing well patients for well checkups and all things such as that. If anyone is sick or if they have any fever, then we don't want them into the well patient areas. And we'll talk with them and evaluate the situation and decide whether or not they need to come through the respiratory clinic, which is where usual faculty staff is actually. But that's the sick area. And if we decide to see the patient here, then they will come through this area. If they have fever, then we really don't want them to come into the center. We'll evaluate what their symptoms are and then either direct them to stay at home or possibly enter the hospital at emergency room in DCH or DCH Northport. So a little bit different. We also have telemedicine now that's really changing things. There were a lot of guidelines from insurance companies that kept us really from doing a lot of telemedicine visits through UMC, but those guidelines have changed for Blue Cross, for Medicare, for essentially all the insurance companies. So telemedicine is a way to talk with your provider about your symptoms, get a diagnosis and possibly some medicine, possibly just symptomatic treatment. But telemedicine, I think, is going to kind of change the game for a lot of us as far as, the patients that we see in clinic. But if you have questions or feel like you're sick and need some help, the best thing to do first off is to call. Call first, and then you'll get directions about what you need to do.
All right, and so there's some advice there too at the bottom of the screen about what's happening with procedures. Okay, and so we're gonna take some questions and answers now, but I forgot to paste in this image I have about symptoms. So we're gonna talk about symptoms for just a second before we take questions. So there are basically 4 types of things going around right now. There's cold, the regular flu, I'm calling it, COVID, and then allergies. And trying to figure out which one of those things you might be feeling if you start having symptoms can be pretty difficult. But what we know is that runny nose, sneezing, and watery eyes are related to allergies and cold, and they're not so much related to the flu and COVID. So if you're feeling that, the runny, sneezy thing, you're probably having allergies or maybe a cold. But then we've got COVID and the flu, and one of the like side benefits of the way we've been addressing COVID is we've also been decreasing the spread of the flu among people because they spread in similar ways. So what we're seeing is that there's a difference between COVID and the flu in that, but all of them can have cough and fever and body aches and headache and fatigue. That can sort of be there for all of them. But the COVID seems to have a kind of breathlessness and cough related to it that's a little bit more distinctive from the flu. That's just the quick version there. Angela, do you want to add to that?
The COVID seems to have less like upper respiratory, nasal drainage, nasal congestion, less of those kinds of symptoms. It's more in the chest, like you were saying. Seasonal allergies generally don't have any fever at all with that. And with a cold, it's usually a very mild fever. So those two things usually don't present with fever. Sneezing, runny nose, ear pain, those generally come, with colds or allergies. The COVID, you usually have some fatigue, weakness, can have some myalgias or body aches and pains just like you do with the flu. Can come with the high fevers just like with the flu as well. But I think the main difference is you don't really get those upper respiratory, it's more of a lower respiratory symptoms for people.
And again, those lower respiratory symptoms are?
The shortness of breath, the tightness in the chest, feeling like you can't get a deep breath. There's some other little clues that go along with COVID too that we're kind of finding as time goes by, like the loss of smell and taste early for some people, conjunctivitis, redness, irritation in the eyes. Diarrhea is a symptom that's not very common, but has been found some lately, or has come up lately as one of the symptoms for some people. So it's very varied, but it's important to, understand some of these things that may clue us in that it may be COVID or it may just be, a common cold or the flu.
Yeah. And Angela, one of the things that I've heard, and I'd like you to tell me what you think of this, is that with the regular flu, we tend to get sick real fast. And with this, it has a slower lead into it.
I think so for some people. I've heard that some people seem to get really sick really fast. And I think that it may be very individual.
Okay.
Some folks, when they get some cough symptoms, etc., kind of brush it off. And, we've all heard the stories of people who are sick one day and then on a ventilator 2 days later. Some people kind of brush off symptoms more easily than others as well. But yes, I do think that the influenza is usually a quick onset. You feel lousy and terrible all of a sudden, and then develop some fever quicker than with the COVID. The fever may come on later with COVID. Yeah.
Okay. And one of the things I've heard people describe too, and that's related to the lower respiratory part, is a kind of a heaviness, like their lungs are like lead.
Yes.
And that would not be part of the normal flu. That would be COVID.
Generally not, especially at the beginning of symptoms. Generally not.
Thank you. Okay, so that is the planned part of this. And now we're going to get to your questions. And I've got a couple of questions here that other people have asked me that I'll ask if we don't get anything in the first few seconds here. Caroline, are there any questions?
We've got, one more. So this is again from somebody in law enforcement. So they currently wear a cloth mask because there's a limited supply of the N95 masks. And they want to know, how do they choose when to wear that N95 mask to preserve the limited supply?
I think using the N95 on anyone who would be especially concerning for COVID symptoms, anybody who had a distinct cough, complaints of shortness of breath, fever, those would be the ones that I would use that N95 if I were having close contact with those folks.
Okay. Any advice? I know your husband is a vet. Any advice about pets? I've heard that they can carry this as well. Not necessarily but maybe on the outside on their fur.
That, like fomites, the virus can live on soft surfaces. It's not thought to live on soft surfaces like fabric, as long as it can live on things like stainless steel or plastics. But it's a possibility. I have not heard of anyone catching COVID, from the fur of their pets, and I wouldn't be just super concerned about it. But if you were sick, coughing with fever, you might want to let someone else take care of your pets, and that would not be the time that you want to, share your food with your pets.
Okay.
Okay, so when, if you could give advice, when should people start reaching out to the doctor or think about going to the doctor if they're experiencing symptoms?
If symptoms seem to be worsening and you're having any problems breathing, then you need to contact your healthcare provider and find out what the next steps need to be. That's super important. If your symptoms are not improving after you've been sick for 2 or 3 days and you feel like you're worsening, you might want to check in with them and talk to them about the symptoms that you're experiencing and decide whether or not you need to be checked out a little further.
Okay, and there's been a lot of talk about testing. What's the current state of testing? What are we doing as far as testing goes?
The testing is still a bit limited. We're not able to do as much widespread testing still as we wish we could. But if you have symptoms, a cough that's not going away, you've had fever, you've had any symptoms after you've been around anyone else that's a known COVID carrier, those may be times when you need to get tested.
Okay, y'all feel free to ask questions. I got a couple more here I'll throw out, but we want to hear your questions too. So, Angela, what are the current treatments that y'all are giving people with COVID at the center, at the medical center?
Well, there's no treatments that are available for COVID. There's no specific treatment, and really there's no specified treatment. They're using a lot of innovative things to treat the COVID with. One of them is the antiviral that was originally developed to use for the Ebola. Remdesivir, I believe it's an analog of adenosine. They're also using some of the chloroquine drugs along with the azithromycin. Those have not been tested in long term for results. But they're doing studies all over the country to try to find the best way to help people get over this. And a lot of innovations probably coming up, but there's no set treatment at this point in time.
So it's basically supportive care that's given?
Yes.
And
Supportive
what does
care.
that include?
Supportive care at home, if you have mild symptoms and not acute respiratory trouble. Rest at home, lots of fluids, staying well hydrated, trying to keep your respiratory tract clear, using steam shower treatments. Some people may need an inhaler, particularly folks who have long-term history of any emphysema, COPD, asthma, those types of things. Rest, just trying to take good care of yourself,
What does a humidifier do?
Humidifier, of course, makes the air more humid, makes it easier for you to get good breaths. You could think about, in the wintertime when we're using a lot of heat, how the air dries out, and sometimes that kind of irritates your respiratory tract, makes that hacky cough a little harder to get rid of. You go take a steam shower and you're coughing that stuff up, and it feels so much easier to breathe after, right?
Yes. All right, great. Did we have another question, Carolyn? You're muted.
Sorry about that. All right. Any recommendations? Do you know how much longer the social distancing will remain in effect? And is it still too early to know? That's the number one question everyone has.
Right. And I wish I knew the answer to that. I don't think anybody knows the answer to that. Um, we'll just have to kind of wait and see. If we open up spaces and people are back together too early, too soon, then we'll have a resurgence. We'll have to kind of go through this all over again. So it's not going to be a quick and easy thing, I think, and suddenly the doors open. I think it'll be probably a slow return, hopefully, to normal. But I think this is probably more of a marathon than a short sprint. And we all have to be patient, keep that in mind, and keep in mind this is to try to keep everybody healthy, keep our families well, and make sure that we don't lose people that we want to keep around.
And so what is the value to the health system of us doing the social distancing?
If you think about how many hospital beds, how many ventilators are available, we want to try to utilize those to the very best of our ability with the smallest number of people as possible. So the more people who require those, then the more likely we are to run out of the ones that are needed for people. And decisions will have to be made about who gets a ventilator and who doesn't. So the more social distancing and the less people who require those means that the people who really need them will get them, and we can hopefully get them over this and back home. So fewer patients means hopefully better access to care.
I've been hearing talk too about antibody tests and starting to figure out who's got some resistance built up. Can you talk about that?
Those are fairly new. I've talked with our lab director about those, and it seems that the ones that started coming out early could show up an antibody for other coronaviral infections. Of course, coronavirus is very prevalent, and there's a lot of different types. So I'm not sure exactly what they're doing to try to be more specific with this COVID-19. But when those come out, and if they are very specific, hopefully we'll be able to find out, people maybe have had COVID and didn't really know it, and hopefully will not be able to get it again. We don't know about that. We know that the coronavirus MERS that was over in the Middle East, that they thought that, or found that people who had that were not likely to get it a second time. So we don't know about that with the COVID-19 as of yet that I've read.
Yeah, I haven't read anything different. But the fact that we have antibodies is a good sign that we might be able to have resistance to it, right?
Yes.
Okay. Is there another question?
There is. So, do you have recommendations if wearing a mask makes you feel like you are suffocating?
Oh, that's a hard one. I've seen some hats that had shields built into those. That might be something that you might think about. Or if you have to be out in public, make those very short trips that you wouldn't have to wear a mask for very long. Or perhaps, have somebody else make your trips for you so that you wouldn't have to wear the mask. So not a good answer to that, but those might be some
I'm in behavioral health, so I'll make one too. I'll answer it.
Okay.
So anytime you have a phobia like that, one of the things you can do is keep yourself calm and actually expose yourself to the thing you're scared of. So you can try while you're at home to put the mask on, maybe put it half on and start with it just around your neck until you can feel yourself calm, and then put it on loosely until you feel yourself calm without knowing exactly why it has a negative impact on you. I can't answer that directly, but if you sit with it and you gradually put it on and you keep yourself calming down to where you can wear it at home and notice that you can breathe well through it, that it doesn't affect your breathing negatively, and get to where you can feel calm with it at home, then maybe you can try going out with it. But if you give yourself sort of like little baby steps into it, you can usually bring yourself to a place where you do feel comfortable with the mask on, even if you didn't start out feeling comfortable with the mask on.
That's great advice.
Okay. Other questions right now?
That's all I have for now for the question and answer
All right.
portion.
Angela, you mentioned some over-the-counter care before. Do you want to give us some details about types of over-the-counter treatments that might help?
Over-the-counter treatments for fever,
Mm-hmm.
body aches and pains. It's recommended to use acetaminophen, which is a trade name Tylenol, for those types of things. For cough and colds, there's a big variety of medications for that. It's like a wall of eternal questions when you go in to look at those kinds of things. Medications with guaifenesin, which is a mucolytic. It thins mucus out. That's what's in things like Robitussin and Mucinex. Dextromorphan's a cough suppressant that's in Mucinex DM and Robitussin DM, and a lot of the Alka-Seltzer Plus and the Dayquil, NyQuil medications. Something to think about if you're taking medications like that. A lot of the multi-symptom medications have acetaminophen, and too much acetaminophen is not healthy, especially for your liver. So you wouldn't want to take Tylenol or acetaminophen in addition to taking a multi-symptom cold medicine. You want to check the labels for that and not double up on that medication. So that's something to think about. I'm a big believer in hot teas and steam showers and that sort of thing. So I think a lot of times some of the more simple things may be beneficial. Chicken soup, I'm a big believer in chicken soup as well. So a lot of things that your mom and your grandmother said were actually true and probably be beneficial and helpful to you.
I've heard people giving each other advice about good ways and bad ways to cough. Is there any best practices around coughing behavior?
Making sure that you cover your mouth and have a tissue if you're possible, and throwing that tissue away and washing your hands directly afterwards. I'm not sure if there's standing up straight, leaning over, whatever works best for you.
Okay. All right, looks like we have another question.
Oh, that was just a comment. Somebody had said that this information has been great.
Okay. Well, in the last couple of minutes, any more questions? Anything that's burning your minds that we haven't touched on?
Hey, Josh, I'd like to just say that thinking about when you're using cleaning solutions in the home, I know a lot of times we think more is better, but don't mix cleaning solutions. You can get into some trouble, actually cause some respiratory damage by mixing things like that. And so don't do that. Use that 1/3 of bleach to a gallon of water. Use that by itself. Don't mix it with any other cleaning solutions. Don't mix ammonia, vinegar, anything like that with any of your other cleaning solutions.
That's really good advice, because that would also affect your respiratory system, which could make you cough, and then you start getting nervous. So it can also trigger all the mental stuff to start happening too. But that reminds me of another piece of advice I've been telling everybody, which is now is not the time to get on top of the 20-foot ladder. Now is not the time to see if you can hot dog it down the street real fast. Anything you can do to keep yourself out of the hospital is going to be a good idea right now when
Absolutely.
all the health system's dealing with everything else. So in your whole life, playing it safe right now is a good idea.
Exactly. Absolutely. Good advice.
Okay, I don't see any more questions, so I'll just point out that we've got some upcoming webinars. We planned one for every week. So next week, we're going to talk about coping at home with Dr. Jonathan Wingo, who is an associate professor of kinesiology, and Suzanne Henson, who's a registered dietitian. So we're going to be talking about exercising and diet and other ways to, while we're at home, cope with the stress and the strain and the change in our lives from the stay-at-home policies. And then the week after that, my friend Rob Alley is going to come on, and we're going to talk about ways we can use meditation for coping. He's a jazz musician and awesome, but also a decades-long practitioner of mindfulness meditation and other types of meditation. And so that should be a really good conversation. And we'll be taking questions then too about how to work it into your life. You know, one of his tips is start with 1 minute, because most of us can do 1 minute of meditation. And then the final one will be April 28th, and that's going to be talking about emotional expression and technology. So how can we stay connected at a distance, and how can we sort of communicate with people that we're having to live up really close to and deal with conflicts and things that come up then. So I hope y'all will join us for those. And unless we have any more questions, I'll wrap this up.
Okay.
Those sound wonderful.
Angela, thank you so much for coming on and sharing all of your wisdom with us about this.
Oh, you're welcome. Thanks for having me. Everybody, please, please, please wash your hands. Most important thing to do is keep your hands washed. Don't eat, don't drink, none of those things until you've washed your hands. Do that, and that'll go a long way to keeping you safe.
Thank you for remembering to come back to that. I have a question too. Like, if you get a cut on your hand, that doesn't make you vulnerable, right? Like, you have to get it in through your mouth and nose.
That is a good question. I would think that any place that would be an entry site is a possible place for an infection. More likely to get it in the respiratory tract, but they've also found this virus in fecal samples for weeks after a person has improved in the condition. So something to think about. They think the more likely place for you to get it is the respiratory droplets, but it does show up in fecal samples as well. So
okay. All right. So wash our hands all the time, as much as we can.
Yes. Yes.
All right. Thank you so much. And thank you all for joining us today. I'll see y'all next week.
All right. Bye.
Bye.